Please welcome Dr. Jeff Egler, Chief Medical Officer for Noom, for Behavioral Change at Scale, what digital health makes possible.
Doctor, my eyes, tell me what is wrong.
Is this thing on? All right. Hi, everybody. Are we having a good time? All right, good. I'm having a great time so far. Thank you for having me here. I am a physician. My name is Dr. Jeff Egler. I'm the Chief Medical Officer of Noom. That is a health technology platform. And so obviously when Fiber Connect asked me to deliver a keynote at the largest fiber broadband gathering in the world, my natural reaction was, what? But now I get it. I'm not here to tell you what I do. I'm here to tell you what you help me do, what you do. There's incredible advances available to us now that are really changing healthcare. And we're going to talk about what you do makes what I do possible, changing healthcare. So Noom, if you're not familiar with it, is the leading behavior change company. That's a bold statement, but I stand behind it, and I'm going to show you evidence of why that's the case today. Yes, I'm going to talk about Noom. I know my audience. I'm not here to sell Noom at all, but I'm here to tell you through my eyes of what I'm seeing happen at scale through this digital health platform, the effects that what you do are having rippling through. So our mission is to empower everyone, everywhere, to live better, longer, every day. And we like to think that we're helping to build the future, along with you, of preventive care. This is what we're up against. And I should pause to just tell you what you're up against. I got a lot of slides. We got too many slides in here. My team told me to cut 20 slides, so I added 5. So I got a lot to get through. I'm going to move pretty quickly. I talk pretty fast, but I'm going to encourage you to do what the airlines tell me to do every time, even though it's a little annoying at this point. Just sit back, relax, and enjoy the ride. Let me do the work. This is what we're up against in healthcare. 70% of healthcare costs worldwide are driven by preventable conditions. And that 70% number is also important because 70% of chronic conditions are actually preventable through better lifestyle. Since 1990, the prevalence of diabetes has increased 4 times. It's quadrupled. And we have 1 billion persons on the planet that are obese. So roughly 2/3 of the American population is overweight, about 1/3 is obese. Those are actually older numbers. The more recent numbers are about 40-some% of our population is obese. And with obesity comes a lot of chronic disease, which we'll talk a little bit about. But what we talk about very frequently at Noom is that the average American with the average American medical care will eventually get the average American chronic disease. Fortunately, there is a fundamental shift happening from reactive care to proactive care. Reactive care being you're diagnosed with a disease, you get a treatment. Proactive care being let's act early to prevent you from getting that disease. Let's make it not happen or push it further down the road. We're seeing this happen in the market. People are showing up and people are spending money demonstrating this shift. We see primary care visits plummeting, while concierge medicine and direct primary care models are increasing. This is because people are gaining an interest in their health. They're gaining this desire to become more proactive. They don't want to wait around until they're sick, or they're starting to become sick, and they don't want to wait around until they become more sick. Why is this fundamental shift happening? It's because wellness works. Everyday well-being adds not only years to your lifespan, but it also adds life to your years, health span. And treating conditions is only half the problem. The other half is well-being, and I would actually argue that it's much more than half. Here's some of the statistics that I think are worth mentioning. There's almost a 30% rise in coronary heart disease risk for each half of a percentage point of a hemoglobin A1C increase. So the reverse is true. If you can reduce your hemoglobin A1C, which is a measure of average blood sugar typically used in diabetics, but we use it in people that think that they're healthy as well, so we can show them that they might not be as metabolically healthy as they think they are. If you can reduce that by just half a point, you reduce your cardiovascular heart risk by 30%. For every 2 pounds of muscle that you put on, you reduce your morbidity and your mortality by 20%. And in fact, those people with the highest quartile of muscle mass compared to the lowest have a 50% lower risk of death. Speaking of 50%, or cutting your morbidity in half, it's amazing to think about a 50% drop in mortality risk for those people that have the highest sense of purpose versus those with the lowest. And a 50% drop in mortality risk for people that have better social relationships. It turns out that loneliness is as harmful as smoking 3/4 of a pack a day. So wellness works. And so there's no medication, there's no Western medicine therapeutic that has these kinds of mortality reductions. And people are becoming more interested. The interest in wellness is growing and growing. In fact, when we look at why people come to Noom, for example, 2 of the 5 more common reasons are they want to lose weight, they want to reduce their stress. Those are problem-based reasons, but the other 3, more than half of the reason that they're coming is more proactive. They want to feel like their best self. They want to be more active. They want to age more gracefully. If you look at the things that they talk about, that they want to work on, that they want help with, lose weight is part of it, but improve muscle, improve sleep, improve energy. These are more functional, related to lifestyle, related to how they feel matters. The way that I always describe Noom, which again, it's an app, it's a health platform, that's a sexy way of saying it's an app. But the easiest way to describe it is we use 3 levers to change care, to change people's lives. And those levers are technology, now medicine, and probably the most important ingredient, in my opinion, is psychology. And we use these 3 levers to overcome 3 barriers that we commonly talk about: access to care, engagement, and durability of treatment. Let's talk about access. You have to get to the patient. You have to get to the person. For the past however long modern medicine has existed, it has always been about bringing the patient to the system. We have to take the system, we have to take the medicine to the patient. We have to meet them where they are. Because going to a physician, going to a healthcare system, going to even a healthcare team that provides the best care once, twice, even 4 times a year, you don't get healthy going to the gym 4 times a year. So we have to meet the people where they are, and that's in their homes, it's on their phones. If you look at the problem, here's obesity, and again, obesity relatively maps to chronic disease as well. If you look at the graphic on the left, this is population of the United States. Try to burn that into your retinas for a second, because I'm going to show you another one. This is our reach with a digital platform. So it roughly maps to the population. So we have 1 million active users across all 50 states, and we're able to penetrate relatively close to what the population looks like. We are providing access at a much greater rate or way than the traditional healthcare system because the access that we're providing is in their pocket, it's in their homes, it's where they live. But it's not only about reaching the person, it's about what are you reaching them with. So we not only support access to care, but whole person care. People don't only need access, they need support. Most people know what they need to do. Most people know what they should do, but they need help with motivation to do that. But why? Now with GLP medications, and how many people here know what GLP medications are? Okay, if you don't know what GLP medications are you in broadband? Do you have the internet? How do you not know what these things are? So GLP-1s are Ozempic, Trulicity, Mounjaro. These are the medications that are causing a revolution, not only in medicine, but it's changing the way people shop, it's changing groceries, it's changing the worldwide economic market. So do you really need motivation anymore? Can't you just give yourself the shot? Well, it works, it does. We have great evidence to support that, but it's not gonna last. The other evidence that we have suggests that 11 in 12 people will stop the medication within 3 years. Turns out that 2 out of 3 people will stop the medication within 1 year. And those people that stop, if they have not done anything else in that interim, if they have not added a layer of behavior change, if they haven't done anything else to change their habits, improve their lifestyle, those people will regain the weight within 18 months. But the data also suggests that people that do things to change their lifestyle, that window is expanded to 4 years. Now you might say, well, they still regain the weight. But that's if they're left untouched, and we have no intention of doing that. We're building an engagement engine to continue engagement. But that's the problem. We think of it in terms of phase 1 and phase 2. GLP-1s have relatively not been around for a long time, but phase 1 was access. It was getting people to be aware of the medications. It was getting people on the medications. But we see that that's not working long term. What we talk about is phase 2. Phase 2 is durable outcomes. How do we support people that are having these tremendous improvements to continue these improvements long term? That's what really matters. Well, it turns out that most people want to build healthier habits. People that come into our program that want to get to a GLP medication, but they come to us because we differentiate ourselves by also having the behavior science piece. They tell us, 85% of them, they want to build healthier habits. They don't want just the medications, nor white-knuckling it with willpower. They want a balanced approach that includes both. That's also more effective and more durable. Let me take a detour. The anatomy of a habit, how habit science works, has very little to do with broadband or fiber, but you might be interested about it in your own personal lives, because it has everything to do with us. It has everything to do with our lifestyle. Understanding how habits work allows us the framework to engage with the patient on a daily basis. So we have every habit, good or bad, has a cue, an action, which we call a micro habit, and we try to break it down into the smallest action possible to help people successfully achieve it. And then we provide a reward or a punishment. We're experimenting with punishment. Just kidding, we're not experimenting with punishment, not yet anyway. But if you provide a reward, it reinforces the cycle. We'll talk about habit horizons in a second, but rather than waiting for external catalysts of this cue, action, reward system, we can provoke engagement through catalysts of our own creation. In order for habits to form, you have to not only want to do something, your motivation, but you have to believe that you can. You have to have a certain level of self-efficacy. Most people will start with a reasonable goal, sort of a small habit horizon. GLP-1s have been found to be a catalyst. They are very successful. People that have experimented with these medications or go full into them have had success like they've never had before. I'm currently with Noom because I was very impressed with the success that they had with weight loss, even before GLP-1s, but just using a habit science or a behavior science platform. But if you take that and you combine it with a medication, you see this big bang of behavior change. What happens is you catalyze motivation. That leads to more success. These people have been struggling with weight their entire lives. Very little success. Suddenly they're starting to have these successes that they weren't able to maintain before. This increases their self-efficacy. It expands their habit horizon. It catalyzes more motivation. That's this virtuous cycle that we talk about. And when you start to have that, you start to not only become the person that you not only think about being the person that goes to the gym, you actually become that person. It actually starts to reshape your identity. And that's sort of the basis of how this system works. So now that we understand how habits work, how do we work them? So I'm just going to quickly list off some things that you'll find in an app like this for the purpose of demonstrating how we engage people. We have intake processes that match people with the best product for them. We have a flow plan, an introduction that supports multiple subscriptions. So what they come in on, what kind of subscription they're interested in, tells us what they want to do, and we're able to provide them and support them in multiple health goals. Mini courses are designed to engage and to educate people, to keep them educated as they are our captive audience. But not only do we have these curriculum, but we have dynamic flows, so people can learn what they want to learn when they want to learn it, rather than us pushing what we think they ought to be doing. And we continuously think about how do we further engage people? How do we get them to stay with us so that we can help support them on their journey? So instead of just providing macronutrients, which many apps do, we're starting to provide them with micronutrient information, which gives them more health insights, which gives them more things that they can do and better insights into how that might be helpful. It also helps them select different nutrition goals rather than I'm just going to eat less food. One of the most important things that we have embedded into our system is micro-habit challenges. So you may be on a path where you're challenging yourself in one way, but this might encourage you to try something else. And the investment is so small because it's a micro-habit, it starts to get you interested in some of these other things. We're using wearables to dynamically measure progress. That gives people more insights, which keeps them more invested. We have daily well-being check-ins, as well as weekly reviews. Again, helping people stay engaged. Recommending new health goals so that they can continue to expand their habit horizons. And of course, we have AI health insights powering all of these. So we have a vertically integrated stack of inputs that feeds into an engagement engine, and through technology, thanks to you, and behavior change, we're able to produce durable outcomes. Now, in the interest of time, I'm probably going to have to go through some of these outcomes pretty quickly. But what we've seen is that Noom GLP-1 users with a companion app have 10 times the engagement of the average health app. We have increased weight loss as well as persistence on the medications. So those people that engage not only with the medication but with a supportive application that they engage in on a regular basis are still losing 25% more weight loss at week 40. They stay on the medication 2.2 times as long. It gives them time to incorporate more of these habits. And nearly 80% of the users stay engaged in the Noom app for more than 4 weeks or more. Think about the apps that you use. How many of them are you still engaging with after a month? Engagement is so important. I think of it as a vital sign. You can have the best medical plan, you can have the best medical minds. If you're not engaging in the plan, it's not helping you. What are some other statistics that we see? Again, not about Noom, it's just about how does this access, how does this digital connection help people change their lives? Well, 75% of our members are able to sustain a 5% weight loss for a year or more. They lose 1.4 times the amount of weight. They're 2.7 times more likely to reach their 10% weight loss by month 4. And 64% of people using the Noom diabetes prevention app are actually able to prevent themselves from developing diabetes. We see 89% of people with improved blood work, and 94% of people say that this medication and this platform help them adopt new healthy habits. We see success on the enterprise level as well. We're partnering with insurance companies and employer health plans, covering 6.5 million lives, and you can see the results that we're getting: cost savings and return on investment. I don't want to skip through this, although my time is getting short, so I'm going to go through it very quickly. We asked ourselves, are we fulfilling our mission of living better and living longer, helping people live better and live longer? So we're using these clinically validated outcomes that actually show that we're living better by helping people feel a greater sense of accomplishment, positive emotion, meaning they feel better in their relationships, and their engagement is improved. Overall composite score, we're helping people in just 5 months' time go from low normal functioning to almost high functioning. And you may say, well, 5 months, is that all you can do? Well, have you tried to change a significant habit and then maintain that habit for a month, 2 months, 3 months? This is astounding in the behavioral health world. What about living longer? You can't really measure that in a short period of time, but there are relative measurements that you can do. And we're actually seeing, in terms of quality-adjusted life years, that people are having reduced anxiety, depression, fatigue, improved cognition, social rules, feeling better about that, and reduced pain. Their utility gain is equivalent to, if they were to continue this for a year, 2 extra months of perfect health. Perfect health being a 1, death being a 0. And if people that started a program like this at 40 continued this for a lifelong with this type of results, we're looking at putting an extra 7 years of life onto their lifespan. So don't get too much into the math. This is done by people that are much smarter than me, but basically it tells me we're definitely heading in the right direction. We can personalize care too. The graph on the left shows a typical titration regimen. People are on medications for 3 weeks, they bump the dose up. 3 more weeks, they bump the dose up. But if you see that if they have a digital application with which they can interact on a daily and weekly basis, they get the information, because they're giving us information, their weight loss. We can identify whether or not they're gaining or losing weight too quickly, and we can adjust the medications. You can see on the right that that is a significant difference in terms of how we treat people. There's much more fluctuation and dynamic, there's much more personalization. Durable outcomes is super important in addition to expanding horizons. So we see that people start with weight, but within a year, they're more interested in improving their metabolic health. 41% of people over people that are not using a companion app. And the habit window turns into real habit change, whether it's improved foods, healthier food snacks, reducing ultra-processed foods, higher protein intake, or less sugary diets. This is an independent study that shows, from Tufts University, that shows the blue line is when people stop a GLP-1. The green line on the bottom is when they stop with a Noom or similar companion app. This one's particularly Noom. It really reduces that amount of weight gain. And this actually demonstrates the blue line is when somebody quits a GLP-1, they regain that weight. Whereas the bottom red lines are with Noom companion app, they're able to make that weight loss durable. Where do we go from here? So what we're doing is we're taking what we've learned and we're applying it to category and condition expansion, using behavior change, which has been the missing link to chronic care for so long, and using technology to be able to help in these realms as well. Wearables give people constant feedback, constant health insights to help motivation and behavior change. And we're actually now looking at putting this tool into physicians' pockets, not only going direct to consumers, but putting these powerful digital tools into the hands, the toolboxes, the EMRs, and the workflows of medical providers. We would not be able to fulfill this mission and vision without the connectivity that broadband brings, which allows us to achieve access, engagement, and durability through technology, medicine, and psychology. Thank you so much for your attention, and thank you so much for what you provide us. I am really excited about this revolution that we're starting to see in healthcare. We're really putting the health back into that. Thank you.
Doctor in my eyes.